Today we're going to discuss how Korean Americans can connect traditional treatments with Western medicine, and how both patients and healthcare providers can integrate these two schools of thought. We're concerned primarily with Korean American elders and first-generation Korean Americans. Let's discuss some statistics before we begin. There are currently around 1,076,872 Koreans living in America. Korean Americans account for about 11% of the Asian American population. Korean Americans as a group display certain common health risks, which may often be treated with traditional remedies. These include, but are not limited to, circulatory diseases, including a high prevalence of hypertension, type 2 diabetes, and hepatitis C. Our first traditional remedy is cupping. Let's take a look at the basics of cupping, and then discuss how to integrate this traditional treatment with Western medicine.
You may be using the cupping treatment to relieve pain or relax. It's important to let your healthcare provider know what you're doing and why. I actually had the opportunity to have the cupping treatment on a recent visit to China.
As a Westerner, when I first saw the cupping treatment being done in the marketplace, I was skeptical about its effectiveness and hesitant about the marks that were left behind. Westerners don't really like to endure pain as part of a medical treatment, and cupping looked like it would hurt. As you can see, I was smiling while having it done, so it must not have been too painful. It felt more like a pinch. The Chinese doctor told me that the marks left from the cups would stay for about 2 weeks, but mine faded after only a few days. However, some people in our culture may not like the way that cupping bruises the skin and not understand why someone would want to have cupping done to them.
That's just one example why you should let your healthcare provider know that you're using the cupping treatment and why. A pharmacist may also be able to recommend a Western medication that could supplement whatever you're using the cupping treatment to treat.
Now that we've discussed cupping, let's discuss how to integrate cupping with Western medicine. Cupping may not be the right treatment for certain patients. Be sure to let your healthcare provider know if you have any of the following: skin conditions, if you're currently taking blood thinners, or if you bruise easily. If you experience side effects from a cupping treatment, you can incorporate the following Western treatments.
Okay, alright.
Over-the-counter oral analgesics for pain at the cupping site, cream to alleviate skin stretching, or topical analgesics.
Cool.
A second traditional remedy is the use of herbal and over-the-counter treatments. Let's again look at some of the basics of how this treatment may be used, and then how we can integrate Western medicine. As a Korean American, you may be using some of the following over-the-counter herbal or homemade remedies: royal jelly, red ginseng, cognac, or homemade acne paste.
안녕하세요. 제가 오늘 homemade acne paste 어떻게 하는지 보여드릴게요. 뭐 필요하는지 말씀드릴게요. 총 밀가루 필요합니다. 그 다음에 설탕가 필요합니다. 설탕. 그 다음에 비누가 필요합니다. 한 숟가락씩 넣으면 됩니다. 접시에다가 비누는 조금만 넣으면 됩니다. 섞으면 됩니다. 이렇게 물 좀 붓고 푼 데가 있으면 거기다가 바르면 됩니다. 이렇게. 자, 여기도 있죠? 이렇게. 조금 있으면 이게 진짜 딱딱해져요. 그리고 자고 나면 씻으면 됩니다. 그러면 핀볼 다 없습니다. 고맙습니다.
If you don't feel comfortable making an acne paste yourself, or if you had tried this treatment and it didn't work for you, there are some alternative Western treatments. These include over-the-counter topical creams, such as Proactiv, and prescription creams and pills, such as Differin or Accutane. There are even some more extreme procedures, such as laser treatment. As a Korean patient, you may be hesitant about some of the more extreme treatments. However, with clinical data backing up their effectiveness, using Western treatments may be more appropriate for patients with severe, painful, and chronic acne. Your pharmacist can help you decide which treatment is right for you.
Be sure to talk to your pharmacist about possible drug-to-drug interactions that may occur with these products.
This may seem like a lot of information, but just remember to talk to your healthcare provider if you have any questions or concerns.
Traditional medicine has been used for thousands of years and is preferred by most Korean Americans.
It is important that Korean Americans be aware of current Western treatments.
This is because Western treatments are the standard for modern medical practices.
While you may have concerns, Western treatments are thoroughly researched and backed by supporting clinical data.
Remember, there are many other traditional treatments that you may be using. However, as a rule of thumb, always let your pharmacist know of any medications or supplements you're currently taking.